Welcome, welcome, welcome back, my Be Health Empowered family. I am so delighted to be here with you again this week for another session of Excuse Me, Doctor. I'm Dr. Mel, also known as Dr. Melissa Clark, but please call me Dr. Mel. You know, we are here each and every week doing what we do best on Excuse Me, Doctor, which is making sure that you have the information that you need to make wise health decisions for yourself, your family, and your community. So now, listen, this is going to be our new time, 8 p.m. Eastern, 5 p.m. Pacific. That's when we're here live answering your questions and also bringing you amazing health topics that you need to know about. So, if you're new to this platform, new to seeing us, check us out on when you check us out on YouTube, please make sure you hit that subscribe button. And when you check us out on Facebook, please make sure to hit that like. That way you can stay up to date. You would know ahead of time that we were starting at 8 o'clock today instead, 5 o'clock Pacific, and you get updates about the show. So remember to put those questions in the chat, and let's get into creating this amazing week for ourselves with these health issues we're going to cover tonight. And we're going to do it with two of my amazing co-hosts, Mr. Wayne Bruce and Miss Bria Good.
Howdy,
How
howdy.
y'all?
Hello. Welcome,
Hey,
everyone.
how y'all
Bria,
doing?
you sound like you got a new mic or something. What's going on down there?
We upgraded down here in Atlanta now. We got an official mic.
Let me upgrade you.
Official
Upgrade
mic.
you. Okay.
Okay.
Well,
So what we
good.
got going on this week, folks? You
Hey,
excited?
yeah, we are deep up in election season, and
Indeed.
that is why we are covering this tonight.
Deep.
Health on the ballot. You know, we can only be as healthy as our environment, as the neighborhoods we live in, and the policies that are in place to protect them. And so that's what we're going to cover tonight. We have an incredible guest lined up, one of whom is already on camera. I'm just saying.
Wow. Move from the co-host to the guest host to the co-guest host. What is she doing?
Everything.
Right. Everything. Everything.
She got energy. She has energy,
She
y'all.
does.
She
She
young.
does. But
has
she also
fun.
has knowledge because she is a reproductive health specialist. And so she is going to be part of our discussion when we, of course, talk about reproductive issues, which we know are on the ballot in several states. So I'm just glad that Bria is going to be able to join us with our other guest, County Councilman Will Jawando. Just wait till y'all meet him. He's a wealth of knowledge. So
a dynamic young man. Well, I'm
Amazing.
calling
Yes.
people young. That's a dynamic man. He ain't all that young.
He can
I
be
ain't
young.
all that old.
You can be young too.
It's all relative. It's all relative.
He plays young on the county council. That's what he does. No, he's a dynamic individual, and we're happy to have him in the county I happen to live in. Y'all don't come hunting me. He's great. He's great.
But before we get to that, health on the ballot, you know we have to cover our topics that just happened in this past week that y'all need to know about.
Let's get with it.
Let's get into it.
Get into it, as they say. First off, every week for the past 2 years we have been covering COVID as the number one topic. But I just want to cover the number one topic this week is Black people are no longer dying disproportionately. Dr. Mel.
Thank you, Jesus. That's all I have to say. It is true. Black people are no longer dying at higher rates relative to our numbers in the population. Unfortunately for our white brothers and sisters, that is what is happening to them. The reason why is because that vaccination gap closed. Black people and Hispanic people stepped up to the plate, have gotten vaccinated, are getting boosted. And unfortunately, like I said, our white brothers and sisters are lagging behind because that misinformation is disproportionately affecting them now and their decisions about whether to get vaccinated. We're still having 400 deaths a day. We're thinking that's going to surge up to maybe 1,000 deaths a day with the new variants that are coming into play as we're going to be going into the winter. So yeah, that's what it's looking like now. And I just hope that, there will be targeted messaging, just like was done in the Black and Hispanic communities, to the conservatives that are sort of still holding out against vaccination.
So, Dr. Mel, you mentioned winter is coming, and that's not just a Game of Thrones thing. That's for
It really
real.
is.
Winter is coming. What can we do? What should people do to prep themselves for the winter?
Yeah, so the winter health prep plan, your anti-COVID plan, address your vitamin D level now, right?
Okay.
So we just know that vitamin D is correlated with all kinds of chronic disease. So make sure that you get your vitamin D level in order, get it checked by your doctor, get on a plan to get it right, because we see that people who have higher vitamin D levels tend to be healthier. Eat your full spectrum of fruits and vegetables, all the colors of the rainbow, because that's where all your anti-inflammatory chemicals are that help your body stay healthy and balance your immune system. Wear your mask indoors. Need I say more? It works. And then get boosted with the new bivalent COVID vaccine, the one that covers the Omicron variant as well as the original one. Get that done now, as well as your flu shot, because that way, by the time the holidays roll around and we're going to be getting together with family, we'll all be protected.
Okay. And you can get them together, right? Flu shot.
Yes, you can.
See, go do it. Go do it.
Double whammy. You get them both at the same time.
And
I'm sorry to hear about our white counterparts, but I'm rooting for everybody Black out there. So glad to hear that y'all are getting vaccinated. So we love that. But we've been talking a lot about COVID, and we have somehow forgot about monkeypox. What's going on with monkeypox now?
Yeah, well, it kind of fell off the radar, but that's because, good news, cases of monkeypox are continuing to decline across the United States.
Good.
The not so good news, even though we seem to be doing a little better on COVID vaccination, the monkeypox is still disproportionately affecting people of color, especially Black people. So these are the numbers. We have about 30,000 monkeypox cases going on right now in the United States, but that's down 85% from this summer. So we're only getting about 50 new cases a day, but of those 50, almost half of them are Black people.
Wow.
So this is the deal. Vaccines need to be more readily available, and that's happening. They're going to make them more available, like at pharmacies, so they're more easily accessible.
Okay.
So prior to this, you could only get them at health departments. So that's one major change that's coming down the line.
Oh, gotcha. And they also need to make it so that you don't have to give your whole sexual history, because it was all about, the gay community this, the gay community that. It's not about your sexual orientation, who you sleep with, how many people you sleep with. It is just about protecting yourself and getting vaccinated. And we just don't want to discourage people,
Yeah, exactly. They really need to remove that as a barrier, because those questions were off-putting, and people might not want to answer all those questions just to get a vaccine.
Yep.
Right.
Invasive. So look, Nana, we're shifting. Well, I'm going to shift the meter a little bit here, because I'm up at night. I'm a creator, and a lot of creators are up at night. So some of us don't sleep well. But Dr. Mel, I hear there's a gift for the insomniacs.
Ooh.
Well, yeah, this might be true. If your person has problems sleeping, or a loved one who has problems sleeping, first of all, you should tell them to see their doctor to make sure sleep apnea is not the problem. Okay, so once you get that out the way, if you're looking for a gift for the insomniac in your life, a new study shows that weighted blankets might be the thing you're looking for, because if they're 12% or more of your body weight, a new study shows that they cause your body to release melatonin.
Wow. So wait, I thought melatonin was a sleeping pill.
It's not a sleeping pill. It's actually a chemical that your body makes naturally, right? and it prepares your body for sleep. So when you take it over the counter, it's not like you take it and boom, you fall asleep right away. It's you kind of tend to have to take it several days in a row for it to kind of help set your body's internal clock in terms of
Okay.
it saying it's time to
Mhm.
sleep, right? And as we age, our body makes less melatonin. So weighted blankets are might be the solution. They might work for that person in your life who's having problems falling asleep. And studies also show they work for people with general anxiety disorder as well as ADHD.
Okay.
Mm. That's really good. I have one of those. I love my weighted blanket, so I
I know.
definitely recommend.
I've talked to a lot of people that swear by them. Yep.
Yeah,
Love them.
I've talked to people who swear by them, but sometimes in my age bracket, sometimes people, have a wife or someone they sleep with who may be getting hot at night. So that weighted blanket thing out the window.
Yeah,
You know,
it may or may not work for everybody. I'm
I'm
just
just
saying.
saying. I'm just saying. It's a
That's
sign
okay.
I'm old.
That is completely okay. So switching topics again, we want to talk a little bit about what you eat and how that affects your brain, right? You know, they always say you are what you eat. So what does this mean in regards to your brain?
So, this is a thing. Ultra processed foods can mess with your brain, and eating them, a bunch of them are associated with a decline in how well your brain works.
Mm.
So, these ultra processed foods have added sugar, added fat, added salt, and they're low in protein and low in fiber.
So you're talking about all the junk food, right? Like the chocolate chips, the candy, the ice
Yeah.
cream, all the packaged
I
materials,
resemble that
cereal.
remark. I resemble that remark. Stop.
All of all of that stuff. Yep, the chicken nuggets, the hot dogs, the fries, all of it. So, over the past 30 years, we've been eating more of these ultra processed foods, also known as junk foods, and they've been linked to obesity, cardiovascular risk, and cancer. Um, and so it turns out for the brain, participants in this study who consume more than 20% of their daily calories from junk food um, had an almost 30% faster rate of cognitive decline, which means
Mm.
their memory, their ability to make decisions, all that kind of stuff going down.
Wow.
Wow. And what does 20% look like exactly?
So that would be like if you have a standard 2,000 calorie diet,
Hmm.
20% of in calories from junk food would be like the equivalent of 2 Kat bars, 5 slices of white bread, or a third of an 8.5-ounce package of chips, which is not a
Uh,
lot.
that's not a lot at all.
No.
That's not a lot.
So you wanna eat a heart healthy, balanced diet that's low in processed foods, high in whole grain, nutritional foods, vegetables, and fruit, and high quality protein.
Wow.
Mm.
That's
So many
good.
things you got to keep up with.
Everything.
Yeah. Yep. I
So
mean, basically, a plant-based diet, we've had a whole show on it. We talk about it all the time. That's basically what it boils down to.
Hmm.
So, Dr. Mel, I turned on the TV this morning and was a big thing on the morning news, national news, about young children and RSV. What's going on
Yeah.
with RSV?
So, yeah, our local children's hospital here in DC and across the nation, they're just getting overwhelmed by all these kids that are coming in sick. Now, RSV, which stands for respiratory syncytial virus, is just a common cold in
Mm.
adults, and it rolls around every winter. But in little ones, especially those less than 1 or children that have underlying heart disease or severe heart disease or severe lung disease or the very old, all these folks are at risk for having, getting really sick basically and not being able to breathe effectively if they get
Mm.
RSV. So, what we should all be doing, good hand washing with soap and water for 20 seconds, covering your coughs and your sneezes, not touching your face with unwashed hands, avoiding close contact with people you know are sick. And if you're sick, don't come to the party. I mean, I don't know why people
Simple.
do that, and don't go to work if you can avoid it. And then clean and disinfect contaminated surfaces like counters and doorknobs. All those are things that you can do to reduce the risk of RSV in your household, as well as other respiratory viruses. And of course, if your little one is wheezing with rapid breathing, bluish or purplish tint to the lips or fingers, that's an emergency. Take them to the hospital right away.
There we go. There we have it. That's why.
Right. So what time is it, Wayne?
It is time for the
weekly Debuff. Stopping misinformation in its tracks.
So, the Twitter finger family always be coming back again and again, always saying something crazy. So today is Trina. Trina on Twitter finger said,
Trina.
I heard on Trina.
Trina?
Trina?
How is Trina? I just read. Okay, go ahead. I ain't gonna say that.
So they said, I heard on Fox where Florida surgeon, mind you, the Surgeon General, he's a Black guy. That was really important to include, said that I can skip that COVID vaccine because I'm a dude under 40 years old. Yeah, Trina is a very versatile name, so it's okay. Don't worry about it. Nonetheless, I don't know. Dr.
Hey, man.
Mel.
Trina could do what they identify as Trina. They could do what they want. They identify. Right. I don't know about that. Excuse me, Dr. Mel. Is that true?
Well, it is true that Florida Surgeon General did come out a couple weeks ago and say that. However, the analysis that Florida actually did to come to that conclusion is very suspect and very bogus. So this is the deal. They're saying that their analysis showed that there's an 84% increase in heart-related deaths in men aged 18 to 39 within a month of taking the COVID vaccine. This analysis, though, has no authors. There's no author's name, so we don't know who did it. We don't know their fields of expertise or experience. They looked at only 20 deaths among men in that age group, although in the period of time they looked at, there were over 940 deaths in that age group of related to the heart, right? They didn't look at all of them. So their conclusions are based on 20 people. There was no comparison group. So, anytime you do a study, you need to do a comparison group to understand what's going on. And then they looked at death certificates to find the cause of death, which are notoriously inaccurate, right? The best thing to do is actually go to the medical record to understand, did the person also have COVID? We don't know that. Were they taking maybe cocaine or something that hastened the death due to a heart-related issue? So there are all these unanswered questions. And so the conclusions that they reached are, like I said, not really something you can hang your hat on. And the study and the quote unquote analysis seems very suspect. And then on the flip side, out of all age and gender groups, the people who tend to have issues with the COVID vaccine are boys aged 12 to 17, not men aged 18 to 39. They sometimes can develop something called myocarditis, which is heart inflammation, but it's very rare. It's 1 to 4 out of 10 every 10,000 vaccines given, and it typically resolves on its own after a few days. COVID itself, getting the infection, causes the same problem 7 times more often, right? So if you're trying to make a decision about whether to get the vaccine or get COVID, and you're concerned about myocarditis, get the vaccine. And then finally, in Florida, there've been over 2,500 deaths among 18 to 39-year-olds due to COVID, right? So they're basing this study about the vaccine on 20 deaths, but there have been 2,500 deaths from COVID. So, take it with a grain of salt. Please tell that to Trina and the rest of her family.
Yeah, I think Trina submitted this on behalf of Tristan, from what I recall, but
that's probably what it was. Yes.
Yeah, I think that's what it was.
There we go. All right.
Wow.
See you, Dr. Mel.
All right. Well, thank you, Wayne and Bria. I know you're going to be sticking around for this because we are going to be getting into right now health on the ballot. We talk a lot on Excuse Me, Doctor about empowering you when it comes to your individual health, but we can only be as healthy as where we live. Is it safe? Is there healthy food? Is the water and air that's available, healthy to breathe and drink? Is there access to health care where we live? We are in election season right now. Early voting has started in many places across the country. What are some of the issues that affect your health that are on the ballot that you should know about? So, to talk about this, we have two incredible panelists. Our first is Mr. Will Jawando. Since 2018, he has been my councilman in Montgomery County, Maryland, one of the top 10 diverse counties in the nation. He's a lawyer with a history of public service at the highest levels. He's worked for several congressmen and senators. And then, of course, he worked for President Barack Obama in his administration as the associate director of the White House Office of Public Engagement. Welcome, Councilman Jawando. Thanks so much for joining.
Thanks for the promotion, and I appreciate it. Good to be with you.
Absolutely. And of course, our own Miss Bria Good. She is a public health professional with expertise in women's health, and she works as a research associate with IBIS Reproductive Health, which is a policy research organization that advances sexual and reproductive autonomy. Thanks, Bria.
Of course. So good to be here.
All right. So let's get right into it. I'm going to start with you, Councilman Jawanda. What kind of power do lawmakers have when it comes to setting policies that affect our health?
Well, quite a bit. Everything from, you mentioned some of these factors in your intro, right? You're talking about all the kind of sociological factors that contribute to health, as well as actual health indicators, whether it would be the quality of your environment, your lived environment, right? Are you in a food desert? Is there a place to access, you talked about healthy fruits and vegetables, a plant-based diet. It's hard to have a plant-based diet if you don't have healthy fruits and vegetables at a store near your house, right? That's connected to development, right? Where are things allowed to go? Where is economic development encouraged? Transportation. How can you get to where you need to work, where your kids go to school, where your services are, to healthcare access? Is it safe? One of the ways that really people don't think about, but here in Montgomery County, Black and brown people are the most likely to be hit by cars, trucks, or buses and to die on our roadways because of lack of investment in physical infrastructure and safe crosswalks and bus stops that are accessible, et cetera. So bike lanes, go down the list. So that's another area. And those are public policy decisions about where those things go and how they're built. Is there access to healthcare, as you mentioned? We as a county, I'm proud of, have stepped up and filled up a gap. And we have a supplemental healthcare program called Montgomery Cares. If you can't qualify for some other type of healthcare on the exchange, or we fill in that gap, or if you're not eligible for some other reason. But do you have healthcare? That's a government has played a big role there.
And just,
so a lot of
just to
ways.
pause there, you mentioned on the exchange. Can you explain for everybody what that means?
The exchange is referring to the Affordable Care Act. And I worked in the White House when we passed it. It was one of my proudest moments. And that was the first step among many to provide health care to folks who didn't have it, and created an exchange. Every state created an exchange, Maryland is among them, where you can go out into the marketplace under the Affordable Care Act and purchase health care if you don't have a job, which is traditionally where a lot of people have acquired health care, or Medicare or Medicaid, that you can get on the exchange and get access to affordable health care.
Makes perfect sense. And so you're saying that there's a gap between whether you can qualify for that or I guess Medicaid. So those people who are in between, you're saying Montgomery County has stepped up. So that's yet another ballot issue in terms of whether you
Yes.
can afford healthcare and how to pay for it.
And also undocumented residents too. A
Mm.
third of our
Mhm.
residents are foreign born. We have some undocumented residents here, but everyone, healthcare is a human right, like housing is a human right. That's where I was going to go next on the housing side.
Yeah.
But yes, so we step up in that gap for those folks as well.
Mm.
Right. And not everyone believes that healthcare is a human right, correct?
Wow.
Unfortunately, that's on the ballot too, right? The Republicans in Congress and others have tried to sue so many times to roll back Obamacare or Affordable Care Act. Thankfully, it has withstood all that judicial scrutiny for the most part, and particularly the mandate. But yes, in our country, for many people, healthcare has been a for-profit industry. It's not fixed.
Mhm.
I know you know that as doctors, all the stuff you have to deal with on the insurance company side. There's still battles to be fought. But yes, I think we should get to a point where there should be an acknowledgement, and the Affordable Care Act was a step in that direction, that everyone should be entitled to health care. No one should go bankrupt because someone gets sick or they get sick. And we're not there yet, but we've made progress.
Right. Actually, healthcare, paying for healthcare is the number one reason why people go bankrupt. So,
Mhm.
yeah, or declare bankruptcy. Um, One of the other things that you were talking a lot about the social factors that determine our health, and that was excellent overview. One of the other issues that I know has made its way to the surface in a lot of communities is the issue of gun control,
Mm.
which is a health related issue. I know when you were a teenager, I understand that one of your best friends was killed in a senseless act of gun violence. Um, and that was one of the reasons you became a public servant. With the school shootings and interpersonal gun violence on the rise, what do you see as a prospect for gun legislation, and um, how should people be thinking about that when they go to vote in their respective areas if gun legislation is on the ballot?
Yeah, well, I was proud to be at the White House a few weeks ago, maybe a month ago now, when President Biden signed the first major gun legislation in over a generation that did some very important things. And as far as
Mhm.
red flag laws, those who shouldn't be accessing guns, expanding funding for mental health, and some other things, there's much more to do. We in Maryland have a relatively strong gun law. You have to register, you have to take training courses. There's a lot, but with 50 states and District of Columbia, everyone having different policies. Our neighbor to the south in Virginia having a very open, wide open policy. There's a lot of trafficking. That was the other thing that this bill that was passed by President Biden cracks down, and it gives a new federal law to crack down on gun traffickers, which is important because guns, just like
Mhm.
drugs, they don't just show up in communities; they're brought there, and then they're
Mhm.
sold, and they're disproportionately in our communities. And I
Mhm.
lost one of my best friends, Calfani, coming out of high school, in an act of gun violence. It stuck with me, and it's one of the many ways we die. It's one of the reasons I declared racism a public health crisis here in Montgomery County.
Mhm.
Many others have, because gun violence is on that long list of ways our life is shortened as people of color and as
Sure.
Black people in particular.
Mhm.
Absolutely. And that whole idea of racism being a public health crisis is novel for many people, but we know that it's definitely linked to these very issues that we're talking about. So thank you for raising that. I want to go to Bria for a little bit because the elephant in the room, and when we talk about health being on the ballot in this particular election cycle, is women's reproductive rights, right?
Mhm.
Um, what has made it so that women's reproductive rights around abortion are on the ballot so intensely this year for people who might never watch TV, listen to the radio, or read social media?
Yeah, it's a wonderful question. So, just as a small recap for everyone that's watching. So, in June, the Supreme Court ruled a decision. It's called Dobbs versus Jackson Women's Health Organization, where they had the opportunity to overturn Roe versus Wade. So that essentially eliminated the constitutional right for people to access abortion and allowed a lot of restrictions to come into place. And with that overturning, it allowed states to have the authority to put in abortion rights or not put in abortion rights to themselves for states, right? So now states have to put it in their own constitutions or make amendments to their constitutions to allow abortion to be a right and allow people to have access to abortion in their states. So now it's up to the states, which is why it's coming up on a lot of ballots in a couple of states.
And I know that different states are doing different things without necessarily going one by one. What are some of the sort of the broad themes that you're seeing in the ways that states are dealing with this issue that people might have to make a choice on?
Yeah, so if you have watched the news, you might have seen that Kansas recently had this come up on their ballot. So they were actually the first state to actually give voters the right to choose whether or not abortion should be solidified in the Constitution. Now, people in Kansas did decide to overturn the option where it was going to be put on a ballot um, where they were going to restrict access to abortion, saying that it's not protected by the Constitution, but people voted and now it's still protected in Kansas. And so this is coming up in other states as well. You might have heard about California, there's Michigan, there's also Vermont, and there's also one coming up in Montana. Now, Michigan, California, Vermont, those are states that are looking to protect abortion rights. So a lot of people have the right to vote on that and have the option to choose whether or not that will be added as an amendment to their constitutions. Now, other states, such as Montana, are not really looking into that. They're looking to restrict abortion rights and essentially make it so that no court in Montana is able to overturn this right, meaning that it'll be solidified that people can't access abortions. So, people in those states, please, if you're watching this, go vote to continue to have access to abortion for a lot of people. So, yeah, please vote.
Yeah. So, and it sounds too like you really need to, as with any issue on a ballot, you really need to read carefully the way that it's worded, because when you vote yes or no, you want to
Mhm.
make sure that it reflects what you really want, right? And
Mhm.
sometimes things are worded so that you can't really, it's difficult, like, to tell, is your yes voting for what you really want or voting against it?
Mhm.
So make sure you read these questions very carefully. Um, so if there
League of Women Voters. The League of Women Voters always has really good
Mhm.
explanations of ballot initiatives, and they're in most jurisdictions around the country. Just to plug for their explanation.
Great, thanks for that.
That's
So
good.
people should just go Google the League of Women Voters and look on their website, essentially?
Voter Guide. Yep, League of Women Voters Voter Guide. Yep.
Wonderful, thanks so much. Um, so on this issue of reproductive rights, if there are
Mhm.
restrictions passed in the state that you live in, what are some of the consequences that, you know, healthcare professionals are concerned about in terms of the health of the women in those states?
Yeah, so one thing to really point out that's really important for people to consider when they're thinking about abortion is that it goes beyond just the act of having an abortion, right? And I think people sometimes become very fixated on the fact that people are maybe accessing abortion and don't think about the after effects of it. So
Mhm.
I myself am located in Georgia where there is a 6-week ban in place. And there has been a lot of studies that have shown that people who carry unwanted pregnancies to term do face a lot of different outcomes, whether that's financially, emotionally, health wise, having more at risk of um, diseases that can actually kill you. And for example, pregnancy in itself and childbirth in itself is actually very dangerous. And so there are studies out there that show that less than one abortion in about 100,000 that people die. So it's under one. But compared to childbirth, about 28 out of 100,000 childbirths result in death. So think about that difference, right? And
Mhm.
comes with pregnancy is sometimes hypertension, gestational diabetes. There's blood clots as well. You might have heard that. So those are some things to consider health wise, but then also on the
COVID is actually pregnancy is a risk factor for worse outcomes from COVID, as a matter of fact.
Mhm.
Yeah.
Right. And don't get me wrong when I say this, pregnancy and childbirth are a wonderful thing. If you choose to carry your child to term, that's beautiful. But these are also some things to consider when you're thinking about other people who may be accessing abortion, even if you are not. So they may also face financial outcomes because there was a
Mhm.
study that I often show people to when thinking about abortion. It's called the Turnaway Study. And they essentially analyzed over 5 years the impact of carrying an unwanted pregnancy to term. And a lot of these people ended up in financial poverty. It resulted in adverse child development outcomes. Also, the children ended up in poverty, lack of maternal bonding. There's a lot of different outcomes. If you do happen to go across that study and read it, I definitely recommend it because I can't put everything in this
Yeah.
one show. But those are some of the outcomes that may
Right.
result if abortions are restricted.
Yeah. And then I also know too that women that have complications with their pregnancy, like tubal pregnancies, or problems with their placenta developing,
Mhm.
and problems with the fetus actually growing as a result, all these potential pregnancies, reasons that people seek medically related terminations of their pregnancy are threatened too in some of these states. So that's
Mhm.
something else to think about. Um, so one of the things is the transition here back to Councilman Jawando. Medicaid actually pays for a lot of pregnancies. People don't realize that almost 50% of the pregnancies in the United States are paid for by Medicaid. So I know Medicaid expansion is actually on the ballot in several states. Can you tell us a little bit about what Medicaid expansion means and if it's on the ballot in your state? Again, what should you be thinking about when you go to vote on it?
Yes, well, as my co-guest said, vote. Make sure you vote. Number one,
Yeah.
but Medicaid expansion is Medicaid is healthcare for low-income residents. It's one of the social safety net programs we have here in the United States. It's a really important way to expand healthcare coverage and reduce health disparities, particularly for people of color, but for all low-income people. But I think it has a disproportionate, not think, it has a disproportionate positive impact on vulnerable communities and communities of color, given that we're more likely to have lack of healthcare insurance and to have lower incomes in the states that have not adopted Medicaid expansion. So if you have that on your ballot, I would, I personally recommend you vote for it because you see there's a gap. We talked about a gap earlier. So poor adults who are below the federal poverty line, they fall into a coverage gap because they're ineligible. They're not poor enough for Medicaid, but they earn too little to qualify for some of the other benefits or tax credits. And so that's where Medicaid expansion kind of widens that out and covers more people. It's one of the biggest tools that we've seen to bring people and address the uninsured numbers. So some governors have decided not to sign up in mostly Republican states, but in all Republican states. And if
Yeah.
it's on your ballot, you have a chance to get healthcare coverage yourself or expand it for people who really need it, which makes us all reduces stress on the system, gets preventative medicine in there, and is really important. So
Yeah.
I think you should vote for it.
Yeah. And even if it doesn't affect you personally, like you need Medicaid, remember a rising tide lifts all boats, right? So
Mhm.
if more people are healthier, you have health and can access healthcare, you have healthier communities, you have people who can show up for work, who are absent from work less often. When they do show up, they do a better job because they feel great. So it 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 helps to have a healthy society who has access to healthcare. So I'll get off my soapbox and
We all do better
realize
when we all do better.
we all do
Mhm.
better when we all do better, absolutely. So, it's that time to bring back, uh, Wayne, who has some questions, I'm sure, from the chat that, for either Bria or for Councilman Jawando. So, Wayne, if you could come on back in and let us know if there's anything going on in the chat, any questions that people have.
Gladly. So we do have a question from Kathy Sindos. Again, what is the name of the Montgomery County Health Plan?
Montgomery Cares. Montgomery Cares is the name of the Montgomery County Health Plan. So you can type in Montgomery Cares, or you can go to montgomerycountymd.gov. If you're a constituent like my great co-host tonight, you can learn more about it.
Right, fantastic. We have a question for Dr. Clark early on. Hang on one second. Geraldine Anderson wanted to follow up on your monkeypox thing. 3 months ago, they were going to change the name from monkeypox to something else. Is that true?
That is true that they talked about it. I don't know that that's actually been done. And I'm not sure why it wasn't carried through, but the concern was that there was stigma associated with the name monkeypox, and also sort of that association with the fact that it came from Africa. And so they wanted to name it something else that is probably more reflective of what the disease actually is. It is a pox virus, so that pox should probably stay there. So it's related to smallpox, it's related to chicken pox. But yeah, I don't know that it actually ever got changed by the WHO.
Okay. So we have a question from Joelle McKenzie in California, and she says, what climate change policies should we be looking out for on our ballot?
That is an excellent question. It was one of the ones that I had, but I ran out of time. So thank you so much, Joelle, for asking it and putting it into the conversation. So, Councilman Jawando, how do issues of climate change show up on ballots in different places?
Yeah, and I meant to say this earlier. Obviously, there are some direct democracy items, like when you have a ballot initiative where you vote yay or nay or on a question, and Bria talked about that, and we've all talked about that. But then there's who you vote for and what their positions are, right? And both are equally important. And things like climate change could be on the ballot depending on the state or locality. Something like a carbon tax or a decision to, things can be put to ballot initiatives. That happens a lot in California, to the person who asked the question. But we're working on decarbonization. For example, I have a bill to require all new commercial buildings to use all electric by 2024. That's buildings and transportation are the top two emitters of carbon dioxide and to our environment. So you have to address those things. We're moving our buses and our school buses to all electric buses here in Montgomery County. Just had an event related to today. So there's a lot of initiatives. Those transitions, as well as transition to solar, all of those things are important initiatives that need to be done in a way that gives subsidies and holds harmless communities that are going to have to make those transitions. That's a big part of it. We have to make these transitions, but often the technology costs more, the infrastructure costs more. The infrastructure bill will help with that. That was passed at the federal level, but it's something from an equity perspective that's important. So I think you want to think about policies and candidates that understand that we're in a climate emergency and that disproportionately impacts low-income communities, and to try to be addressing it with some of the solutions that I just talked about.
Okay.
Great. And can I just tack on something else to that? When we think about climate, we also think about just environmental health in general. We know that you mentioned racism was a public health emergency. One of the reasons why has to do with the fact that, unclean drinking water, air pollution tend to show up in Black and brown neighborhoods. Think about Jackson, Mississippi, the crisis that going on with the water crisis down there. That all had to do with allocation of funds to fix the infrastructure and the decision to or not fix it in Jackson, where there were disproportionate or large numbers of Black people. So I think, to Councilman Jawando's point, who you vote for in terms of their policies and how they think about equity and health equity also comes into play too.
Absolutely.
Absolutely. I think we look now. I'm a football fan, so when you say Jackson now, everybody who's a sports fan says Jackson now, we think of Jackson State because of Deion Sanders and the amazing job he's doing down there. But I'm guarantee it was homecoming last weekend. I guarantee you it was many politicians in that audience for that game. But how many of those people really looked out for that community when the water issue came up? And the water issue affected the football team also, you know? So it's very important you choose politicians that will benefit your community top to bottom. I mean, who would have thought that a university would have had a water issue? But if that university is in an area where there's a water issue, the university will suffer also.
And Councilman Jawanda, while we're talking about that, how important is citizen advocacy and getting these issues to your attention?
It's of the utmost importance. You know, there's a saying that the squeaky wheel gets the oil, but and there's a lot of squeaky wheels, but they don't necessarily represent the diversity of our community or folks that are most impacted, because, you know, part of the systemic inequity that we have is the structures were set up to exclude and to not include some. And so a lot of the work I do is trying to get out into the community, to go where people are, to understand what's happening and to get their feedback on what's going on in their lives and their communities, and kind of demystifying the public policy process so they know that they can testify and how they can come in and they can write in and call in. There's no wrong door to come in and make a suggestion or a complaint or have an idea. And I think, unfortunately, that is a big constant challenge, whether it be language access, you know, people be able to get transportation. One of the best things of silver linings about the pandemic was we had to start doing council sessions remotely, and we started taking testimony remotely. We had never, I didn't know what Zoom was 3 years ago, like many people. And now we are able to, you know, the majority of people testify remotely, and that's opened up who can testify if you're on your lunch break at work or those kind of things. So it's a constant struggle, but it matters a lot because a small group of people can influence massive change.
Wow. We have a question from a Sean Perry who's just tuning in, but said, what is the county, and this question is for council member Jawanda.
I appreciate it.
Yeah, we keep wanting to call you Congressman.
Look, we're going to put it out there. We're going to put the energy out there, brother.
We're going to speak it into existence.
Right. Speaking it into existence. What is the county doing to bridge the technology divide to include not just access, but training and resources within the senior community, as well as the underserved?
That's good.
Yeah, that's a great question. I mean, obviously there are always across the country, you know, we're better than most, but we still have, one of the things about Montgomery County is we have rural communities, we have suburban, we have more urban communities. And one of the things, many things that COVID showed us was it just blew up all the fault lines across our county and our state and our country. And if you had a small problem before you, it really got exacerbated. And connectivity was one of those, right? You know, you still have a lot of people that don't have broadband access, that were driving up to libraries to sit outside or walk, you know, to use the Wi-Fi. And so there is obviously a connectivity issue, just basic connectivity issue when those public spaces were closed, at least inside. How do you get people, particularly our seniors, who utilize, you know, say our libraries, for example, our senior centers, which were closed during the pandemic, which are now back reopened. How do you get them connected to those services? And we had a lot of food distribution happening. We had our seniors were isolated if they couldn't get out, and we were delivering food to people. We started to accompany that with a survey of what else do you need? And it's we heard connectivity, you know, that came up as one of the issues. And so we started providing some MiFis, And there's always training that could happen, there's always a digital divide on the training side. But there's always more you can do there. But those are some of the ways we're approaching it. We have a senior advisory committee that we consult with to try to give us recommendations on what our senior population needs. So there's some of the things we're doing. We can always do more, but that's just a flavor.
And I think that's probably Sean Perry, who has a radio show and advocates for seniors. It's a senior radio show. So I'm thinking that's who that is, given his question.
Okay. Dr. Mel, you got anything?
Well, I wanted to ask too, what do you have any examples that you can come to mind, Councilman Jawando, about how local advocacy influenced some policy, just to sort of give our audience some concrete examples of how it works?
Sure. Yeah, I can give a couple quick two examples. One, during COVID, I saw when you had the lead in, you talked about how there aren't disproportionate COVID rates anymore, thankfully, and testing has gone up. But at the beginning, you remember we were getting it at higher rates and we were dying younger. And we were, 55-year-old African American got COVID. They were dying at the rate of a 65-year-old white resident who got COVID because of some of the other conditions. So we set up at the time an African American Health Initiative program that was targeted strategies at the African American community for COVID, and had targeted events. We set up a Black Physicians Network that if you're not in, Dr. Mel, we need to get you in, where you had culturally competent care, and that's still going, where it built out a referral service to Black doctors. So we don't want to just deal with your emergent COVID issue. We want to get you in primary care and get you in an environment where you're seeing a doctor regularly and doing preventative. And then we funded that program, Councilmember Rice and I, the other African American council member, and that work is still happening. Testing, identification, and other this physicians network and other things. So that's an example of that. Some folks came to us and said we need a targeted approach for the African American community, and we listened and we did that. I'll give you another very small example quickly. I worked a number of years ago with a community that they had a door at their school, at their middle school, that was always unlocked and open. And we worked with these parents. This is before I was elected, to organize and write letters to the school board and to the administration to get a new security door in that building. And through that process, they used their voices. They learned who had the levers of power, and they got a problem solved. It could seem like a small thing, but that's how, it's important to understand your power and understand how to access the decision makers to get something done. And so I think whether it's something small like that or some big program like I just discussed on African American health program, all of that matters, and your advocacy, your voice matters at every level.
Yeah, and I think it just underscores when people say all politics are local. We're talking about, ballot initiatives and voting, but also understanding that the decisions that are made at your local city council level that you can directly influence by going in, just like you said, and making your voice heard, whether it's in person or by broadband, which I thought that question about broadband, following on from what you talked about testifying, that was yet another way that broadband is actually a social factor that influences health and our engagement and our education. So, yeah. Any other questions from the chat, Wayne?
No, but I just want to say this. If those people would have had Joe Clark as their principal, that door wouldn't have been.
Get those chains off the doors. Get those chains off the doors.
Right. Exactly. Well, I want to thank you all. This was really excellent. We covered a lot in a short period of time. Thank you so much, Bria. Thank you so much, Councilman Jawando. This was really informative. And of course, thank you to Wayne for bringing in all the questions from the chat and the audience, which always has some fantastic questions just waiting to be asked and answered. So thank you all for joining. And I just want to remind everybody as I always do, that we're working with Howard University on a special research study. And they've asked me to invite everybody who listens, everybody who's part of this Be Health Empowered family to participate. It's totally voluntary, and it is a COVID resilience research study. You don't have to, have had COVID. That's not important. What is important is just communicating through 2 surveys how you have coped and been coping through the pandemic. That's all it's about. So 2 surveys, and you actually get compensated $100 in the form of a gift card for your participation. So if you have any interest whatsoever, please reach out for more information to Dana Harvey. And her email is on the screen there, danaharvey@gmail.com. That's DANA, Dana Harvey, HARVEY, research@gmail.com. Thank you so much for joining again. Remember, if you haven't hit like yet on Facebook, please do that. If you haven't hit subscribe yet on YouTube, please do that. We will see you back here next week, 8 o'clock. Remember, a new time, 8 o'clock p.m. Eastern, 5 p.m. Pacific. Thanks again for joining. And if I don't see you before then, remember, be wise, be well, and be health empowered.
I guess I should think. They invited me. They still don't know. I hooked up with Dave 3 days ago. He'll start coughing tomorrow. And I bet in 10 days he'll be on a ventilator. Now, his wife, she's not vaccinated because she thinks it'll prevent her from being pregnant. But what they don't know is that I can decrease sperm count. Sorry, Dave. Good luck with that.